Good morning, everyone. I am Janae Best, and I am a Master's of Public Health student here at the University of Michigan, Health Behavior and Health Education. Today I'm doing the Instagram takeover. Feel free to hit me up with any questions that you guys may have. Looking forward to showing you guys what my day looks like. All right. Hey friends, so I'm with my friend Sarah, and this is Marcus. They're both NPH students in FB. Sarah's a second year, and Marcus is a first year.
First year.
Yeah, so we're at the Student Ambassador Brunch. It's the last day of classes. We are happy. It's lit. Going home soon. Yeah. Okay. Hey y'all, so real quick, while I'm waiting to meet with my boss and my department chair about a couple of projects that I'm working with her on, someone sent me a question, asked, is it hard working as a student, and then also asking where I work and asking about the job application process for students. So I work for the Center for Research on Ethnicity, Culture, and Health here at the School of Public Health. I work with my department chair, Dr. Cleopatra Caldwell, on a couple of her projects. One major project is called Fathers and Sons. Yes, it can be hard working as a student, but you just have to really be intentional about trying to have a good work-school balance and being sure to communicate whatever you have going on with your boss and being realistic about what you can take on. And the job application process isn't too strenuous in general for a lot of the jobs that I've seen. You just simply find a job via a database that we have for jobs for U of M students. You apply. There's usually some sort of interview process. So I encourage whoever's interested in applying for a job just to simply go for it and to not be afraid to reach out to people who are doing research that aligns with your interest.
That this is not just a Black problem, it's not just a white problem, it's a societal problem, it's a huge community problem, and it's a United States problem because gun violence has now crossed over to schools.
Hey y'all, so we got a couple of questions. One of the questions was, did you take a gap year? If so, what did you do? So I can't quite answer that question because I went straight through from undergrad, Spelman College, University of Michigan. So I grabbed my friend Marcus, who's a first year PhD student, who's going to share what he did during his gap year.
Hi everybody, as Janae said, my name is Marcus Andrews and I'm a first year PhD student at HBHE with the particular focus looking at how neighborhoods influence health outcomes and health behaviors around cardiovascular risk and obesity. So I actually took a 2-year gap year after my Master of Public Health, after I graduated from my master's program from the George Washington University, and I took 2 years to work at the National Institutes of Health as a part of their post-bac ERDA program, which allowed me to work in the social determinants of obesity and cardiovascular risk laboratory in National Institutes of Health, where I did a lot of research around CBPR and looking at technological literacy among urban African Americans, and also looking at using large epidemiologic data sets to look at the relationships between neighborhoods and health. So make sure you check out the National Institutes of Health and other government agencies that may have different internship opportunities that you can take advantage of to make the best out of your gap year.
So one of the questions that we got was, how did our undergraduate experience prepare us for a career in public health, or prepare us for the NPH program here, or in general our experience here at Michigan Public Health? Well, for me, I worked as a RA conducting research in a couple of labs during my time at Spelman. Also, I was a part of various internship programs. One was the fastest program at the Harvard School of Public Health. I also made my own internship one summer at a school called NCCU in Durham, North Carolina. I also interned at the CDC in Atlanta through a program called FLIP, Public Health Leadership Fellowship Program through Morehouse College and the CDC. And Marcus was actually a part of that same program, but a year or two before I was a part of the program.
Yes, so I did Project Imhotep, which is a partnership between CDC and Morehouse College in Atlanta. So I did a summer internship there, and after I finished with my undergrad at the George Washington University in Washington, D.C. So essentially my undergrad was in sociology with a focus on health and wellness. So public health is very multidisciplinary, and you can take your existing interests and always lead it into some type of public health outcome.
Hey y'all, so got another question. The question was, how did you know that Michigan was right for you versus other schools of public health? So for me, honestly, it came down to funding. My funding offer, scholarship offer for University of Michigan was better than that of other schools. Also, I also had the dream to be able to conduct research abroad. So this summer I was able to go to Ghana for 3 months and conduct research. Funding for that to me is just awesome and like much better than other schools. Also, I saw an opportunity to be able to do research that I was interested in, and paid research at that before I even came here. So knowing that I would be able to be fully funded, have a good job, and just be able to, in general, like pursue my dream of doing research abroad.
Hey everyone, my name is Alex Eanes, and I'm a second-year HBHE MPH student, and I'm a friend of Janae's, and we're in the same cohort. So the question is, how did I know that Michigan was right for me? I didn't know until I got here, but here I am, 4 months away from graduation, so clearly I'm enjoying it because I stayed here. But similar to Janae, I chose Michigan because of funding. But I also chose Michigan because in my personal statement, I was very intentional about researching who I wanted to do research with while I was here. And I was lucky enough to be matched with the professor who I wrote about, which that is Dr. Reve Amico. And so we do HIV and PrEP research. PrEP is pre-exposure prophylaxis, for those who do not know. And during my time here, I've been able to do a project with a sexual health organization in Flint called Wellness, and doing HIV and PrEP promotion and prevention research with them. But overall, it's been a great experience, and Michigan has definitely helped me learn a lot about the field of public health and really helped me hone in on what I want to do when I graduate.